there's a signing in paper coming around. Please sign it so we've got the attendance record. We do have a new member with, so what I would do, just indulging you all, I'll just quickly whip round everyone, just explain who they are very briefly for our new member. Is that okay?
Yes,
Michelle, with you. Off you go. Thank you.
Good morning. My name is Michelle Legg. I am a GP at Tower House Surgery in Ryde. I am the Deputy Chief Medical Officer of Hampshire and the Isle of Wight NHS, so to speak, and I'm the Clinical Director for the Isle of Wight.
Thank you, Michelle.
Morning, Wendy Pereira, Chief Executive at the Isle of Wight Council.
Good morning, I'm Joe Smith. I'm the Chief Officer of the Isle of Wight NHS Trust and Ambulance Service.
I'm Emma Carina. I'm the Voluntary and Community Sector Representative.
Hello, I'm Ian Lloyd, Strategic Manager for Partnership and Support Services for Adult Social Care.
Working. Hi, I'm Pete Smith. I'm Service Director for Commissioning and Partnerships. I'm here on behalf of Laura.
I'm John Graney. I'm here to represent the Isle of Wight Association of Local Councils, and I only knew which button to press because I watched him.
Simon Bryant, Director of Public Health.
Councillor Debbie Andre, Cabinet Member for Adult Social Care and Public Health.
Good morning, I'm Rob Mitchell, Superintendent Area Commander for Policing on the Isle of Wight.
Councillor Ian Stevens, Deputy Leader of the Isle of Wight Council, Cabinet Member for Finance and Housing, Homelessness and a few other bits and pieces. Thank you.
Marie Bartlett, Democratic Services Manager. I'm here to take the notes.
Thank you all. That's really helpful. I'll move on to the minutes, page 5 and 8. We'll probably need to confirm. So those that were here need a proposer. And thank you, Simon. A seconder I need. Thanks, Deb. So those in favour, any comments on the minutes? Those in favour of confirming as a true record? Please show there's no. Okay, that's a true record. Thank you. Declarations of interest. Any declarations of interest? Therefore, make my own declaration that I'm involved in care provision on the Isle of Wight, and should there be any items that talk directly about that, I will not participate. Public question time. Do you have any public questions, Marie? No questions. No one in the public gallery. Chairman's update. There is very little to update other than we're taking account of yesterday's budget to see how that impacts the local authority more generally in terms of funding and finances or obligations that may be hidden beneath the headlines. The detail, as it were, of the budget from yesterday. Other than that, there's no further updates, and we'll wait with interest all the extra money that's probably not coming, but there we go. Item 6, the Better Care Fund, pages 9 to 14. Is that you, Pete, or you, Ian?
Apologies. So I wasn't actually going to present it. I was just here on behalf of Laura, but it's just a quarterly report. So, yeah. Yeah, we do one each quarter. Yeah.
Therefore, the update's printed for you. Are there any comments on the update? Quite morning, isn't it?
Don't worry about that.
Well, There we are. We'll move on. That is the
Sorry,
update.
Chair, with respect, the recommendation asks us to note the financial position, but also to approve the return. We could take that on block, perhaps.
Well, we need a proposer for that. We need a proposer. Somebody needs to propose that. Devon, thank you. We need a seconder for that. Thank you. So those in favour of that, please show. You have that? You've got that? Okay, so that's noted and that's also approved. And item 7, page 15 to 18 is the Smokefree Generation. So this is you, Simon, isn't it?
I'm going to fight the microphones. You've got a report. The purpose of the report is to give an overview of the Smokefree Generation programme. So for a bit of history, when the then Prime Minister Rishi Sunak announced the bill around the Smokefree Generation, he also gave local councils through the public health role increased funding for the Smokefree Generation programme. So this paper being, as it sets out in number 0.3, smoking is the single most preventable cause of ill health. So actually, if we can tackle that and reduce that right down, we will have a healthier population. So the money's great. That means we can increase the access to smoking cessation. We have really good access across the island. But we want to, as the recommendation says, strengthen our referrals. So that relies on all of us. So what can we do to strengthen our referrals into the smoking services? So we're not asking people to actually have to do work on helping people give up. We've got that service, but we need more people and more people feeling able to ask and confident to ask clients and others about smoking. We can offer training. And then amplifying the messages. So it is Stocktober at the minute, so lots of messages going out. So when you see those on social media, please do forward them on. And then I think we would like to ask other workplaces to sign the Smokefree Pledge, which leader and chief executive, I think was it about 6 months ago we signed roughly. And so as a council, we signed that. Michelle, I know that we've managed to get the ICB to sign, but I wonder if other organisations around the table would like to sign the Smoke-Free Pledge, which basically says, I will increase referrals and I will do my bit to reduce smoking on the island. Very happy to take any questions, Councillor Jordan.
Thank you, Simon.
Somebody stole my badge. Simon, I used to work a lot in children and young people's work, and one of the things that we found is the increase in vaping in school-age children and in our services as well. So one of the things I'm definitely signing up, and that's something I'll take back to the voluntary sector forum for individual organisations, but I'd be really interested to hear a little bit more about the plans for children and young people and whether there might be some resources coming out to help us with existing systems. So in the charity I work at, we've done things like ensured that smoking's never visible to children. So even if you have, one of our sites is 95 acres, you can't just say it's a no smoking site, people will go and smoke on it. So it's about setting the infrastructure up so children never see it, things like that. Is there anything coming out that might help?
So I'll say a couple of things, and Lauren, who's my colleague behind, may want to add in. So for me, we want to work with organisations like yourself. So actually to say this would be helpful, we can work alongside you to think about the way that we support organisations, the way that we enable training and things like that. So we want to make that work. So yes, we are setting up a quit vaping service because that's really, really important for our young people, because we know, as we've seen, vaping has increased and we want to reduce that. And the new bill from the government will help, which is saying actually single-use vapes are going to be banned, and also there's going to be more tax. So all those things are helping, but what we want to do is help people who want to give up to do that. So yes, there is kind of lots of plans in place. Lauren, anything you want to add? You haven't got a mic though. Lauren's the person to link to in the council who will help you with that.
Simon, Debbie.
Thanks, Chair. I'd just like to highlight one of the key areas of focus, again, with young people, is working with our schools and colleges. Teachers, parents and carers are mentioned, but not the young people themselves. And I'd just like to highlight that I'm sure we're aware that our current youth MP has made vaping, trying to stop as many young people starting through vaping as possible. So I think it's important that we do actually link in with the young people themselves. And the youth MP, yeah, we've linked in with the youth MP. So I think that's an important thing to highlight.
And just to say, I'm not sure if Michelle's aware, the ICP coming up for Hampshire and Isle of Wight is focusing on young people's, they want to present that, and vaping is one of the issues they want to talk about. So we are part of that conversation as well.
Thanks, Simon. Any further comments, questions? There being none.
So Councillor Jordan, just one of the asks that Marie sent around, we really want to know how other partners are going to increase referrals. So Joe, I think we really need to kind of get stronger links from the hospital. How do clinicians and nurses feel about raising the issue of smoking and talking about it? I know there's a new maternity advisor, but I think we need to do more in that space.
Thank you, Simon. That's so. What are the inhibitors of us in our respective organisations and wider organisations not signing, committing to this? That's, I think, the question I'm asking. I wonder if there's how we take that from here. I mean, that's the point. It's all very well having it as a written document, but we want this actually working out in the community, don't we? With the commitment from our partner organisations. I mean, where are the gaps, Simon, in that? How do we pull this together? How do we do that? I mean, is this
one of the reasons
for bringing it here? People we're going to ask to sign.
One of the reasons for bringing it here is to help us, because as we all know, when we work together, sometimes there are blockers. As the senior leaders, I guess what I'm saying is, if there is a blocker that we experience trying to really ramp up this work, please can we come back and recognise we have committed to doing this, and there's more we can do. Our chief executive wants to help.
Thanks, Simon.
I don't smoke. So I think the decisions that the board are being asked to move forward clearly, I think, set out the ask to the senior leaders of organisations in this room to actively pursue an action on this, particularly the last one, where we are saying the board is asked to sign a pledge committing to smoke-free policies. Now, I take that as being every organisation that's part of this health and wellbeing board actively saying, yes, they will, as an organisation, sign the pledge. So my suggestion would be that if we agree the decisions and recommendations on the paper, that gives Simon's team the authority then to approach the organisations and ensure that those actions are delivered.
We'll be happy with the pledge. We haven't seen it yet, but the pledge.
Well, we've signed it, so, and I think we're not asking you that we will help. So it's, so we can do that together. But yes, we can share the smoke-free pledge, which is on the website, and I'm very happy to talk. Rob, recognising you cover a large patch if we need to talk.
I'm quite happy to cover anything for Isle of Wight policing, anything that would help our organisation get involved with that. Happy to discuss. Thank you.
I'm very happy to sign a pledge. Obviously, from a health industry, we're very committed to smoke-free policies, and we have many policies around not smoking. I suppose the question for me is, what will be different if we sign this pledge? What are the actions? What are the additional actions that we might sign up to? Because signing a pledge, I think, yes, no problem, but what will we do?
Phil, can I come back on that?
Yeah, I think you better. I'm just reading it because the sign and pledge committed to smoke-free policies. You can read this in public places and workplaces, including the removal of smoking shelters. Could be quite contentious.
So so what we're seeing with the new government legislation is that actually hospitals will not have smoking shelters. So you can have places where people who are using vapes to give up can congregate, but also won't be able to smoke on the paints. It's much stronger. So actually we need to work through this. I don't know. And maybe one of the asks of the trust is, can we do an audit to see how many people actually asked about smoking when they go in their appointments? And I suspect not. So how do we really think about, it's a really important health issue, but yet, you know, if I'm really cheeky, you kind of say, do you want an X-ray? You don't do that. You say, you're going to have an X-ray. You don't say, oh, do you want to go? So how do we change the momentum? Joe, I'm very happy to talk to you and the clinicians about how we could do that in the trust.
Simon.
I think we do ask most people that come for an appointment about whether they smoke or not. It's part of the clerking in and the taking of the information. So we absolutely would do that. It would be impossible to police an area that said, are these people vaping because they're giving up, or are they vaping because they've taken up vaping? So that just, you know, isn't something that I think we could do. And you run into all sorts of problems if you have a shelter that allows vaping but doesn't allow smoking. And I've worked in a number of trusts that have tried to go smoke free. I've gone around trusts and taken out smoking shelters, and all it does is it drives it into areas that they're then smoking under office windows and everywhere else, and it becomes really difficult to police. I think the solution to this is the way that we're going is around education and is around promoting healthy lifestyle as opposed to prohibition, because I've seen us try to implement prohibition in trust sites, and it's very, very difficult, and all it does is it moves the problem to the back of the bicycle shed.
Thank you, Debbie.
Just quickly to come back on that, one of the things that Simon and I discussed is actually, and it goes along with your theme of education, Joe, is about having signage where the smoking areas are to actually get that message across. And that's something that I think we are planning to implement here at the Isle of Wight Council. Let's start with our own organisation. But I think you're perfectly right. I think it needs that signage so that when people are in those areas where we know people smoke.
Thanks, Debbie. I'll just go, I don't want to labour this, but it does say including the removal of smoking shelters, and it does worry me a little that's quite a big...
It's in line with the national proposals. So, and we know, you know, I'm in other trusts around the county. So we are allowing people to smoke in something. So as a health and wellbeing board, I suggest we say, we don't think it's the right thing. We recognise there's other factors in there. But yeah, it's a challenging area. And that's why otherwise as a board, we just go, yeah, that's great. So I think we do want to challenge ourselves about the right way forward.
Just a quick observation picked up earlier on about trying to make smoking not as visible in public places, particularly influencing younger generations. It is a transition phase just to maybe have places that have got smoking shelters to have them in non-visible locations, to sort of try and phase it out that way. I mean, certainly from us, we don't have, you know, we don't have smoking in police buildings anyway, and we don't have smoking shelters anyway to that stage. But places that have established and maybe a halfway house to transition would be to have them in non-visible places.
Yeah.
Right.
Terry, I would agree having smoking shelters in non-visible areas. Better. Where we don't allow people to smoke, what happens is, especially on the St. Mary's side, there's only 2-minute walk down to the main road to the bus shelter, which is now on public property. I have no control over people And that is a very visible place because it's right out the main road. It's right out in front of the hospital. I think the smoking shelters offers an opportunity as well because it gives us an area to focus education. When we don't have those, people are scattered around and they're hiding in various places, and therefore there's no way to get at those people. There's no way to bring that forward. I just want to make it really clear, I'm very, very supportive of this. And from a health background, you'd expect me to be that, but I see the damage it does every day. So I'm very supportive, and my comments are about us being able to move forward in an effective way, as opposed to me saying I'm kind of against this.
Thank you. Michelle?
What evidence do we have that young people are most influenced by seeing adults smoking? And are they much more influenced by their peers smoking and vaping? I don't know the evidence. There must be data out there, because I would have thought that there'd be something about a national comms campaign that goes on social media, TikTok, Instagram, Snapchat, all those things that young people are on, to show the damage, as opposed to us getting very worked up about workers, where they're going to smoke, as opposed to putting our efforts where actually young people are influenced most, because this is what we're talking about, young people smoking. And I'm not sure, I don't know the evidence. I don't know what the data shows that how they're influenced most. Knowing young people, I would have thought it was their friends, but what do I know?
I can come
I'm
back
an
to
old
that if you
person.
want to, Emma.
Thanks, Michelle.
Thanks. Simon might have some kind of more up-to-date evidence, but the stuff that we've been doing in our workplaces relates to the research around alcohol, which demonstrates that the visibility of it and access to money and not being supervised are the three key factors that start children drinking alcohol. And Simon might be able to describe research specifically around smoking or vaping, but our assumption is that's probably likely to be the case too. So if you make it not if you're never aware of it, you're never going to start it. So even if our contribution is tiny to the not having the awareness, it's still worth doing.
So yes, it's about norms, social norms, and we know that children of smokers are more likely to smoke. So therefore you kind of, and that's our campaign that I sent to Debbie last night, is around, my mummy smokes, therefore I'm going to smoke. It's all about that. So how do we kind of change that campaign?
To be clear, I'm not against, I'm absolutely for anything that would stop young people from smoking. I also know kids whose parents smoke that say that they'll never smoke because they can't stand the smell of it and stuff. So I just, knowing our resources are limited and our time is precious, I want to make sure that we maximise it. That's all I was suggesting. But I certainly, let's minimise the visibility of it. And hopefully if the government gets their way, we won't be selling cigarettes in the future.
Okay, thank you for that, Michelle. Any further comments on this? Ian?
Well, I'm going to go against the grain a bit here. I'm sorry to say, but I'll just throw something in from the other side, which is if you're going to hide these smoking areas away, then they start to become, people that want to use them probably won't even bother to use them. They'll use another area that's close by, and young people will probably find them in a secluded or a quiet area and utilise them not just for smoking or vaping, but possibly drinking and general antisocial behaviour anyway. I think the best way is to put it out there and let it be seen, because I don't think that people look at other people and say, well, I'm going to smoke because that person smokes. I think that it's something that is, and I think, Michelle, you hit it on the head. I think it's more peer pressure than actually seeing your parents smoke, etc. That's my opinion. More damage is done with smoking with young people in the home than outside. And I just feel that quite possibly, if you start to drive these things away in a semi-secluded area or out of normal sights and vision, then I think that you might find that you create a problem that isn't there at the moment. Thank you.
Thanks, Ian. I'm going to move this on. I suspect that we are all supportive of this, and the recommendations and our options are endorse and promote the Smoke-Free Generation, commit to working with the public health team, align, amplify smoking, vaping, communication messages, as Michelle has been talking about, but the actionable one is sign the pledge. So if we're happy to approve that, are there any that would not be happy to do that? There's nobody showing they wouldn't. I'll take that as being therefore that we are supportive. Well, is anyone for, not for, not against, so abstaining? You're looking at me as though you want to not have an opinion on this.
Got an opinion. As I've just stated, if it's moving towards some secluded areas for smoking, then I'm a little bit against that, because it drives it away from normal vision and what have you. And I think that could cause.
Sorry, I think we just have to gently challenge that, if you don't mind, Councillor, is that we've just had evidence that actually the evidence shows us that if children see people smoking, it may encourage them to smoke, which is why we're not trying to hide it away, but we're trying to say that smoking shelters wouldn't be highly visible. And so I just want to be clear that you understand that data, sir.
Thanks, Michelle. Rob?
Yeah, just to clarify, Councillor, it could be that I'm confused as well. Obviously, young people getting into antisocial behaviour and criminality hidden away is a concern to me as well. But my understanding of the shelters, we're talking about workplaces, aren't we, as opposed to random shelters in public places. This is places of work for employees as opposed to young people being able to access them.
Thank you, Rob, for that clarification. I was going to make that point myself. John?
As a member and not an officer of IWALC, and IWALC being an association of associations, whilst I can personally agree, I can't promise to sign anything. Not in my power.
We would ask you to take it back to the members.
I will take it back,
Great.
certainly.
Thank you
put it
very
in my
much.
report, but I can't agree to it here.
John, I absolutely understood. You're here representing an organisation. It would be the organisation we would ask to sign. Absolutely. We're all okay? Therefore, we've approved all of those recommendations and options. Thank you for enlightening this. And so let's move on to the Isle of Wight Poverty Reduction Strategy. This is pages 19 to 58. This is Ian, isn't it? Please, Ian.
Thank you, Chair. And I will take it that the paper has been read, and obviously you've all had an opportunity to review the strategy. To start with, I think it'd be remiss of me not to say that there's been extensive work undertaken over this year to conclude this piece of work, to produce the strategy in front of you. And it hasn't just been from the council. I need to be very clear that this has sought collective engagement from across all of the partners on the island, very much within the voluntary sector, and Emma has been a key part of that as well, but also with our association of local councils too. So the opportunity to feed into this is to get the collective views to produce the strategy that we have in front of us today. I'd also say as well that the strategy reflects the fact that we know that poverty across the country is difficult at the moment, and it reflects all ages. And equally for the island, as indicated in the strategy, we have data as well to support the impact and needs associated with the island. This doesn't necessarily specify exactly how it's going to be resolved, and it may be that we cannot resolve all poverty, but what we are setting out are the stalls in terms of how we will work collectively to try and address the impacts that are felt through this. The reason it's here within the Health and Wellbeing Board is that there is a very strong link to the Health and Wellbeing strategy. This is about people's wellbeing. This is about the health implications as well as the wellbeing implications. Equally, the strategy has reference to the fact that this strategy alone will not contend with some of the needs. There are links to much wider strategies, whether it's to do with the economy, whether it's to do with the trust, and I'm very pleased to see that within the trust strategy at the moment, there is reference to deprivation and impacts of that. So it's to try and bring it together so that we are clear in terms of the approach and aspirations we have as an island. The strategy has three key targets, three key priorities in terms of how we're seeking to address this. One is about targeting support for island residents experiencing poverty now. That's the work that we do day to day anyway. It's been happening. And there is a lot of good work going on within the community from a range of partners to support our island residents. So it's to build on that. It's to reference it and it's to also build on it. The second priority is to support island residents to help prevent them falling into poverty. So it links back to the education, it's the awareness, the advice, and also what we can do to try and prevent it from happening in the first place. And the third one, which is probably the most critical, is about what we're seeking to do in the longer term. And that is to work in partnership, and it's to look at what we can do collectively with limited budgets, limited resources, but how we can be more productive and proactive in terms of some of that. So without labouring the points, the report provides you with a summary. I hope that you've had the opportunity to review the strategy itself. The critical thing that's being sought from this board, if I may please, Chair, is that obviously we're seeking approval to sign this off for the island. And I do stress this isn't an Isle of Wight Council strategy. This is a collective island strategy, and that's the really important point. And in referencing that, it's also about what happens after this strategy hopefully is being approved today in terms of it's about partners seeking to take this strategy back to their respective boards or organisation governance to endorse and to support the delivery of it. And as will be indicated in the paper, the work really starts after the strategy has been approved, and there will be the need to set up a partnership delivery group in order to bring the strategy to life and form the action plan. Thank you, Chair.
Thanks, Ian. Any questions, any comments? Debbie.
Just a quick comment to say that this is an extensive piece of work, and I'd like to thank the officers involved. And it really has been engaging with all our partners. And as Ian said, it's not an Isle of Wight Council strategy, it's an island strategy. And it's very important that we do get that narrative right moving forward, that this is working with our island partners to reduce poverty for our island residents. Thank you.
Thanks, Debbie. Wendy.
Thank you, Chair. And I echo the comments that Councillor Andre has made. This has been very clearly a piece of work that has pulled together input from across the island, not just organisations and bodies who are delivering, but the voice of those people who are struggling as well. And I'm really pleased that it's been able to include that. From a council perspective, I think, you know, we already have in our cabinet reports, don't we, the section that's entitled poverty and reducing poverty. So I'm really keen to ensure that as we move forward with decision making, we really use this strategy and consideration of the wider health and well-being of our community to set out under that heading the impact that our decisions are going to have, because I think that's going to be really important. Because there's one thing that we talk about regularly in this meeting, and that is the impact of not having access to homes, not having access to education, not having access to jobs, being, you know, in financial constraints has on people's health, has on people's well-being, has on people's behaviour, and everything in here underpins what we as a board should be doing through the health and well-being strategy.
Thanks, Wendy. Any further, Simon?
Just to build on Wendy's point, we are about health and well-being here, poverty impacts on health and well-being. So it's absolutely right that we endorse this strategy here and also think about what we can all do to varying degrees depending on our influence and our role, but I think it's really important for health and wellbeing of the island.
Thanks, Simon. Couple therefore, no more comments, because a couple of observations, our observations, they're not criticisms, they're observations. But when I open it up, front of the last page, Isle of Wight Council, I'm concerned that it will be seen as an Isle of Wight Council document.
I'm really pleased, Chair, that you raised that, because I've had a bit of pushback from our own comms team actually on this. So they were adamant that it needed to be on the bottom of it for the production where it came from them. But I have also said that I'll be taking this to Health and Wellbeing Board, and we may be reflecting on that.
Comms, yeah.
So just to confirm for the comms team, this is a cross-island strategy. What we should have is a page at the start of the strategy with the logos from all the organisations that have signed up to this, and it doesn't require an Isle of Wight Council logo at the bottom of every page.
Thank you, Wendy, for that. Equally, at the back of the strategy, we have listed all of the organisations and partners that have been involved. So rather than trying to get all of their logos, we've specifically named them. So I'm happy to take that back to comms to remove that, and really appreciate the comments.
I hope the board makes a decision, not the comms team. I mean that in the, so it was an observation, but thanks, that's been addressed. A couple of other observations, now just observations, that the actual strategy, often when I read documents of this nature, you get local case studies in it, and that seems to be an absence of case studies. I just think they're quite useful at times, that could have been a bit of an oversight. And I can't find too much to do with adult education, and there is a correlation between educating adults and children public. So that's just two observations. Yeah, Michelle.
I know it's difficult in these strategies. So firstly, the strategy is excellent, and thank you. I can see it's taken a lot of work. The photos tend to be glossy, showing affluent areas of the Isle of Wight. As much as that's lovely to see, and I know it's difficult to maybe not put affluent pictures in, I just think it's a little bit disrespectful if we're talking about a poverty strategy with pretty pictures of, for example, Ventnor, and lovely photo of, the Downs with the sunset. I don't know how you do that, but particular the picture on page 25, showing some boats, and I think it's Ventnor. It's a lovely photo. Ventnor looks lovely, but that's not the point, is it? The point is that, I don't know how you get around that, but I think it's a little trying to make it glossy and pretty when actually we're dealing with really, really hard issues here, which shouldn't be glossed over with photographs.
Thanks, Michelle. I think the point's really well made, actually, and I can see the difficulty, but well made points. Thanks for that, Michelle. Wendy.
Yeah, I just wonder if that's the opportunity where those photos currently exist, to replace those photos with quotes from individuals or organisations, or something meaningful in a different way. So we just use the space differently, because I think it is a really good point, and but we're not here to kind of design it, are we? But take the opportunity to make use of the space differently.
Thanks, Wendy. Ian? Oh, sorry. No, okay. Any further comments? Well, we are asked to, as Ian pointed out, to approve this strategy and to encourage members of the board to take the strategy to their respective organisations and boards of governance and sign off. Are we happy to? Is there anyone here not happy to do that? There isn't.
Sorry, Chair, can I just make a further comment? You mentioned about there aren't any specific case studies, but there are quotes included in that from the surveys that were carried out. So it's not that the strategy doesn't, so that's how the voice of our residents has been captured. on pages 16 and 17.
I think the point observation I was making, not a point, an observation I was making, as Michelle has made with imagery, you've got a poverty strategy and imagery of anything but poverty is a contradiction. I think that the narrative of local case studies are quite powerful, not in an image sense, but in the sense of the words that come out of the case study, where you take where a strategy is actually, and it's an example of where the strategy is working on the ground. It's an observation. That's all. I do see it often in documents of this nature, case studies. That's all. Anyway, we're past that into we need to take on board the comments. I think looks like you have, Ian, and that puts us in an awkward position. I'll come to you. That puts us in an awkward position because we're asking to approve this, and now we haven't got the final document and images and narratives. I'll come to you after, Rob, to do that. So I'll come to you after, Rob.
Thank you, Chair. I think what you've just said kind of links in with what I want to say, because one of the things that we really struggled with in the thinking is what are our key measures and what are the changes we're seeking, and we couldn't define them and we decided that actually we'd keep those measures quite vague, and the delivery of the strategy is where that will be defined. So I think there's an opportunity for further refinement of the document at that level that could then feed back into what the final thing looks like for publication. But the call to action for the Health and Wellbeing Board is how does that action group get formed, who's on it, and what are we going to do about this as a group of partners?
Rob.
Yeah, it's just a slight observation from my point of view. Yep, I get what we say about the images, but it works the other way as well, doesn't it? It shows that it's actually under our noses, and that people are struggling in affluent areas. They're invisible to people so it might actually people who live in that area who don't recognise poverties around them might actually make them look and think, is that happening here in this nice place? Yes, it is.
Well, we have that island wide, of course. We know that. People looking at our chocolate box island and our thatch roofs, and we know that we have some serious areas of deprivation. That's a good point, Rob. Thank you for that.
So going to your point, Leader, about the strategy agreement, I don't think anything that we've talked about this morning will change the content of the strategy. It's about the look and the feel of the document. So if we treat the document as a draft document to be finalised once all organisations have signed it off through their processes, that gives us the time to finally refine the look and feel of the document, and that will be published after everything's gone through formal sign-off processes.
Thanks, Wendy, for that clarification. Therefore, are we all happy under that clarification to approve this draft strategy? Anyone not happy to do so? That's pretty unanimous. Thank you all. Just on to the joint strategic needs assessment priorities. That's probably you, Simon, isn't it?
This is we had an informal meeting quite a little while ago now. I really want to identify people, bring people to slide 17, which, otherwise they're not numbered. It says who, where, and what should be our collective focus, because I think as a board, that's where we really need to go. And when you look down that list, we're talking about inequalities. We've talked about that with the poverty reduction strategy. There's probably more we can do there. We know particularly the challenge we have on our ageing population. Age is one of the strongest predictors of ill health, and we are getting older. So what do we do about that? And I think we need to think about now, this year, 5 years' time, because we are not going to get younger. What we know is in the country we are aging, but the cities are not. So anywhere that's not a city around the country is aging much faster than the rest of the country. So thinking about that. So London is not aging, but we are comparatively more. I think, there's a couple of very specific things about increasing our dementia diagnosis rate, thinking about our NHS coronary vascular disease health checks uptake. Right down the bottom, back to smoking. Lung cancer is our biggest cause of morbidity and premature death on the island. So actually, smoking is key. Targeted lung checks in the hospital is absolutely key. So there's some things that we really want to focus on in this document, and how do we carry on doing that together? And I think this gives us a really clear parameters as a board of areas to think about and how we then move that forward.
Thanks, Simon. Any questions, any comments? Wendy?
Sorry. I was just looking at the bullet point that says connect employment and health. And it just strikes me that given the budget announcements yesterday and funding for DWP around Connect to Work, which is about people who are currently out of work, getting them back into work and staying in work, I wonder if we need to extend an invite from this board to a representative for DWP to be part of this board, because I know some of us are involved in work programmes, whether that's through Isle of Wight Council Community Services Directorate and or other organisations that we represent. But as the funder, I wonder if it might be an opportunity for us to have that representation directly on this board.
Thank you, Wendy. Any views or comments on that?
I think Wendy's absolutely right. I think as a board, we tend to think about ill health because that's where our comfort zone is, because that's what we do as a day job. So how do we move that into a different space? Michelle, I wonder if you and I could work with ICB, because there is a post employed by Portsmouth City Council and to work an ICB funded post, but I think because they're employed by Portsmouth, because of the way the funding works, they focus on that area. So if you and I could see if we can nudge through Cam and that team, that'd be quite helpful to get them around this table for a discussion, Wendy. So maybe that's an item for the next meeting, kind of unemployment, work well, and we can work. Marie, if you can help me work that agenda item up, we can do that for next time.
Thanks, Simon. We seem to be happy with that approach. Okay. Thanks, Simon. Appreciate that. And so the NHS Hampshire Isle of Wight renewing our ambition and joint capital resource plan. Consider the short form strategy, outline a ambition to working. Whose paper is this? Is this you, Michelle?
I do believe it.
Natasha, are you online? So you don't really like controlling here. Natasha, are you chair?
I am here. I wasn't expecting to present the paper, unfortunately. I thought that perhaps either Caroline or Roz would be in attendance. Michelle, I mean, I
Don't worry.
I can talk to it.
No, don't worry. It's fine. I just didn't want you to be online expecting to do this, and then we don't ask you to do it.
I wasn't expecting.
That's fine. That's fine. So we will look at the paper and take the paper as read. Are there any points that anybody has on this paper?
There are no points, Michelle.
Thank you, Chair.
Therefore, we will consider that we've considered the short form strategy outline edition. Thank you for that.
Councillor Jordan, just say that paper had to come to this board in the new guidance, so that's why it's here. Really, it's for information, as Michelle said.
So that this board does note that item. Thank you for that, Michelle. That leads us on to the Isle of Wight Safeguarding Children's Partnership yearly report. Now,
got Debbie Key online.
Thanks. Hello, Debbie. Welcome.
Thank you.
Perhaps you'd like to present that to us.
Thank you. So thank you for the opportunity to present the 23-24 yearly report to your board. It's a reminder that the publication is a statutory function of our Safeguarding Partnership as defined in Working Together 2023 and presented to your board to ensure you're cited on our work and our strategic priorities. And certainly from the conversation this morning, you can see that some of the areas you've discussed are reflected within the report, the priority around education and certainly well-being and also the cost of living crisis. So I'll just share those with you. A couple of highlights, because I'm very conscious the report is very detailed, as it always is. We've undertaken 2 thematic audits during this financial year in relation to our strategic priorities, and the findings and learning from there are detailed within the report, looking at child sexual abuse within the family environment and vulnerable children who are persistently or severely absent from education. And of course, recommendations arising from reports such as these are monitored through the partnership to ensure that they're completed. We've also been busy implementing the changes in Working Together 2023 and looking at findings arising from the completion of self-assessment audits in relation to safeguarding standards by all the agencies on the island that contribute to the safeguarding and wellbeing of our children. You'll see a comprehensive training programme which continues to respond to the needs identified through our learning needs analysis, which takes place on an annual basis and includes learning from serious safeguarding cases and also audits. But I just wanted to take an opportunity to look forward in the way that the report details around our strategic priorities for 24-26. We have a priority around safeguarding children through supporting their engagement in education, a focus on the prevention of neglect and cumulative harm, and making sure that we continue to implement the changes outlined in Working Together, and promoting and embedding the work of our partnership. One of the challenges partnerships do face is making sure that we reach all our key agencies across the island, making sure they know the resources and guidance and training that's available to them in supporting their safeguarding practice. Our independent scrutineer, Scott McKechnie, is providing oversight and scrutiny to the development of the on-island multi-agency safeguarding hub, and our partnership team is also engaged with the relevant work streams arising from that, just to make sure we can support with communication and training for the wider multi-agency workforce. There will be a review of strategic priorities in January 2025, and that may lead to further areas of focus for the partnership. Just finally to note, we are looking at producing a child-friendly yearly report moving forward. We know that some partnerships do that. We want to do that in the most effective way possible. And we are expecting a national review of child sexual abuse to be published by the National Child Safeguarding Practice Review panel imminently, where we'll look at our local learning and see how that corresponds with the learning that they've identified. So it's a report for you to note. And I'm happy to take any questions if there are any.
Thank you for that, Debbie. Any comments or questions for Debbie on this? Wendy.
Thank you, Debbie. And I do have a question, because I guess I'm a little disappointed on page 45 about reading that child protection conferences during the 23-24 period had to be rescheduled because of quoracy issues, and understand that you are monitoring that. I mean, at the end of the day, children's safeguarding, the responsibility sits with the chief executives of the council, police and the ICB.
Yeah.
So I'm quite interested to hear your views on whether that situation has improved over the last year, because I'd be disappointed if it hadn't. And I would be asking my counterparts in police and the ICB to ensure that, as the 3 respective lead agencies, we ask our teams to make sure that they ensure the meetings are quorate, so that those important conferences can happen, because the delays only impact on the families and the children themselves.
Thanks,
yes. Thank you, Wendy. That's a really relevant point to raise. And I know that Rob Mitchell is in the room with us as one of our delegated safeguarding partners for the partnership. It is an area of focus for the partnership. We are monitoring that on an ongoing basis. The report that came, which is referenced within our annual report, looked at quoracy between August and October last year. So there was some reference to the impact of the holiday period, which also brings up its own issues in relation to what arrangements are in place during those critical kind of moments around school holidays. So it's an area of focus. And in fact, our performance quality and assurance group received a an assurance report from all agencies around what they have in place to improve this picture. There is also a piece of work going on across Hampshire, Isle of Wight, Portsmouth and Southampton, being led by the ICB about the health contribution to child protection conferences and making sure that not only are they attended, but the right person is in attendance at those conferences. So thank you for highlighting that, Wendy, and I'll feed that back into the executive.
Thank you.
Thank you for that, Debbie. Wendy, just a comment from me that no children's services representatives in the room today. That is because at this moment in the building we have Ofsted doing a focused inspection. It's not a regular inspection, but it's a focused inspection on safeguarding, and the report will come. Their conclusions for that will come out in due course in short weeks. Ian.
Thank you, Chair. Touching on what the Chief Exec said, I'd also like to raise a concern that those attending those child protection conferences are fully briefed before they attend them. So they're fully understanding of the nature of the cases that are being heard. Thank you.
Thank you, Ian. Any further comments, questions? There are none. The reports for noting, as Debbie has pointed out. Debbie, we've noted it, and thank you for taking away those concerns and comments from Wendy. That's helpful to us also.
Thank you.
Yeah, and Ian's, yeah.
Yeah, thank you.
That leaves us on to members' question time. I'm not quite sure what this means. I've asked our monitoring officer before what members means in terms of question, whether it's members of the board or members of the council. I'm never quite sure. There aren't any members of the council, but at other meetings there are members of the council.
You've got people online.
I'm just saying that at meetings there are councillors who are members of this council, and I'm never sure members' question time whether it's the members of the board to ask the question or the members of the council, and I'm still waiting absolute clarity on that. I believe it's something to do with the constitution rewrite, but there we are. It's waffling. And any questions from members of this board? There are none. Therefore, at 10:28, that's the end of the meeting. Thank you so much. I'm not sure the exact date of the next meeting. It's in the diary, but I can't recall it. It's January, I think. And thank you for your attendance. Thank you for your comments and interventions. It's helpful to this board and to the wider community that we all serve in our own way. So thank you.